procedure's now finished and we would like to unglove and ungown. There's a particular order that we do these in. So once you've packed away your trolley and it's all been unpacked and all we're left with is the cover, or sometimes no cover at all on your trolley, what you need to do is pull your gown from the front here, and you'll probably hear it. Can you hear it? So then what you need to do is very carefully, sometimes I will tear this piece in the front here, or undo it, depending on which one you need to do, and only touching the dark blue side. So only touching the side that was sterile, because that's the part that's going to be covered in the blood. All right, I pull that sleeve off, remembering that I've got blood on this glove, so I only touch this side of the gown and I pull it off. Okay, and I've pulled that one, and quite often, and you can see that there's some distance between me and the gown. All right, I don't want to get the blood from this gown onto me, and I would pop that straight into the bin. I've pulled my gown off, and so what I've done to make this maybe more clinically visible for you is I've actually put some texture marks on these gloves so that you understand that these are the contaminated gloves. So I don't want these bit touching any of the skin here. So what I do is I grab the glove in the middle there and pull quite firmly and turn the glove inside out. All right. This one, I've got a clean hand. I put it in under the cuff there and pull this cuff down over the other glove, thereby containing all of the contaminant in the gloves. So what we've done is throw the gloves out into the bin. What you've now got is, once you do this in the clinical space, you realise that you've got quite wet hands. They're quite sweaty. And so the back, it's dark, it's wet, and there's bacteria present. So that means we've got colonisation of bacteria on your hands. So the principles here that you need to observe is making sure that you don't touch anything. Because if I now touch my shirt, what I'm doing is transferring all of the bacteria that have been colonising on my hands onto my shirt. If I pick up a pen to sign the count sheet, I then put the pen back in my pocket and I drip that bacteria all over the operating suite. So what I need to do now is immediately go to the sink where I scrubbed, wash my hands, dry my hands, come back, sign the count sheet and do any other documentation and help the perioperative team from there. Hope this has been helpful.